Good afternoon, Kevin Holland. Let's begin the warm-up session. Why did you choose to become a nurse?
There are several reasons why I chose nursing. First of all, many of my relatives are nurses, and their stories inspired me a lot. Besides, nursing is a profession with an ocean of opportunities, both native and abroad. Above all, this is a service-oriented profession in which I can serve humanity. Hence, I chose nursing as my career.
Why did you choose OET?
It is my long-term ambition to work as a registered nurse in any English-speaking country, such as the UK, Ireland, and so on. To meet the requirements to register as a nursing professional there, I need to prove my English language proficiency. Hence, I chose OET to fulfill my dream. Moreover, OET is tailored according to the needs of nursing professionals. I believe I could perform well in this test.
What are the current trends in your profession?
Nursing is a dynamic profession, and changes happen daily. Nowadays, technology plays a vital role in my profession. For instance, paper records that we used in older days have been updated to electronic records. Besides, at present, we are following evidence-based practice, which means there is a scientific rationale for every procedure. Moreover, in the present days, a nurse can function as a nurse practitioner, which is equivalent to the position of a physician.
Do you have a role model?
Yes, I do. My role model is my mother. I follow many things that my mother does. It is from my mother that I learned the basics of kind behavior, decision-making, and organizing skills, a polite and humble manner, helping and sharing mentality. The care and respect she gives to everyone makes me wonder sometimes. She is a perfect example of womanhood. I believe a nurse should possess all these qualities. She is my superhero.
Which is your favorite destination? Why?
My dream destination is Australia. The first and foremost thing is that Australia has a world-class healthcare system, and I can be a part of it. Secondly, the country has a better standard of living and economic and political stability. Besides, here nurses are paid well and respected too. In addition, I have many friends and relatives over there, so they can help me during my initial days.
Your preparation time is over. You can now start your roleplay.
Hi, good afternoon. I'm Kevin, one of the nurses here in the community health center. May I know your name, please?
Good afternoon. My name is Mihiraa.
Hi, Mihiraa. Could you please tell me the reason for your visit?
I haven't been sleeping well for a while now, and I really don't know what to do anymore. It takes me a long time to fall asleep, and then I keep waking up during the night, just looking at the clock. During the day, I feel very tired, and it's getting hard to focus at work. This worries me because my job is very busy and I need to think clearly, but lately my mind just feels cloudy. A friend said that sometimes other health problems can mess with your sleep, so I thought it was time to come and talk to someone about it instead of just trying to handle it by myself.
I'm really sorry to hear you're going through that, Mihiraa. It sounds exhausting, and you're right to be concerned when it starts affecting your work and how you feel during the day. Can I ask you a bit more about what's been happening? For example, have you noticed any other symptoms?
Yes, there has been some stress at work lately with a few big deadlines, so I do find myself thinking about that a lot when I'm trying to sleep. My mind just keeps going over everything I need to do. I haven't really noticed any pain waking me up, but I do feel a bit on edge during the day, like I can't properly relax. Sometimes my heart feels like it's racing for no reason. I just wish I could switch off at night and get some proper rest.
Thank you for sharing that, Mihiraa. It's very common for a busy mind to make it hard to switch off at night, especially with big deadlines looming. What you're describing, the racing thoughts and feeling on edge, is a clear sign that your mind is struggling to power down. Since you've mentioned that stress is a big part of this, let's start by talking about some changes you can make to your routine and environment. These are often called sleep hygiene strategies, and they're very effective for exactly the kind of sleep difficulties you're having. The first, and one of the most important, is about what to do when you can't sleep. If you're in bed and you can't fall asleep within about 20 minutes, or you wake up and can't get back to sleep, the best thing to do is to get out of bed. Don't just lie there watching the clock and getting frustrated. Go to another room, do something quiet and relaxing in dim light, like reading a book or listening to calm music, until you feel sleepy, and then go back to bed. This helps your brain associate your bed with sleeping, not with being awake and stressed. Another key piece is consistency. Our bodies love routine. Try go to bed and wake up at the same time every day, even on weekends. This helps set your internal clock. Also, think about your bedroom environment. The ideal sleep space is cool, dark, and quiet. Would you say your bedroom is like that?
Not really, to be honest. I usually have the TV on low for background noise because I don't like complete silence, and I often fall asleep with it on. My partner also likes the room quite warm, so it's not always cool. I never thought about that being a factor.
That's really helpful to know, Mihiraa. The TV is actually something that could be contributing. Even if it helps you fall asleep, the light and noise can disrupt your sleep cycle later in the night, causing those wake-ups. The blue light from screens also tricks your brain into thinking it's daytime. I'd suggest trying to switch it off at least an hour before bed. Since your mind is racing with work thoughts, a simple relaxation technique might help. Even 5 minutes of deep breathing before bed, like breathing in for 4 counts and out for 6, can calm your nervous system and slow that racing heart. Some people also find over-the-counter magnesium tablets helpful for relaxation and sleep. It's not a strong sedative, just a gentle support. You could ask your pharmacist about it. Before we move on, do you have any questions or any other concerns?
Those suggestions are really helpful, thank you. I think I could try the breathing exercises and turning off the TV earlier. But I do have one question. A friend of mine was struggling with sleep, and her doctor gave her some sleeping pills. She said they worked really well. Is that something you could prescribe for me? I just wonder if it would be a quicker solution while I work on these other changes.
That's a fair question, Mihiraa, and I understand why you'd ask. It's natural to want a quick fix when you're exhausted. I should be clear that it's actually not within my role as a nurse to prescribe medications. But more importantly, for your situation, prescription sleep medication probably isn't the best solution, even if it seems like the faster route. The medications your friend took do work, but they come with significant downsides. They can be quite habit-forming. Your body can start to rely on them to sleep, and over time you might need higher doses to get the same effect. Then, if you try to stop, the insomnia can come back even worse than before. They also often leave you with a hangover effect the next day, grogginess, dizziness, and trouble concentrating. Given that you're already struggling to focus at work, this could actually make your daytime problems worse, not better. The strategies we've discussed aim to restore your body's natural ability to sleep without any of those risks. It might take a little more patience, but it's a much safer and more sustainable path. Does that help explain why we're focusing on these approaches instead?
Oh, I didn't know that. I thought they were just an easy fix. The hangover sounds terrible. I already feel foggy at work, so I don't want to feel worse. And I definitely don't want to become dependent on anything. Okay, that makes sense. I'll stick with the other things we talked about.
I'm glad to hear that, Mihiraa. You're making a really wise choice for your long-term health. I also want to reassure you that what you're going through is extremely common and very often temporary. Sleep difficulties like this are frequently just your body's normal response to increased stress, like those work deadlines you mentioned. The racing heart, the busy mind, the trouble switching off, these are all signs that your nervous system is in alert mode, and it's having trouble shifting into rest mode. The good news is that with some consistent habit changes, you can absolutely retrain your body to make that shift more easily. It won't happen overnight, but if you stick with these strategies, you should start noticing improvements. Before we wrap up, is there anything we've discussed today that still feels unclear, or do you have any other concerns?
That really helps to hear. I feel better knowing this is normal and can get better. But I also think I would like to see a GP. Just to be safe, To check if there might be something else going on, as you mentioned before. Would that be okay?
Mihiraa, in fact, that's a very sensible approach. Since you're planning to see a GP, let me give you some guidance on when to make that appointment. I'd suggest giving the sleep hygiene strategies we discussed a fair try for about 4 weeks. Sometimes these changes take a little time to work, and your body needs to adjust. If after 4 weeks you're still struggling, or if your symptoms get worse, then definitely follow up with the GP. Also, if you notice any new symptoms like feeling sad or hopeless most of the time, losing interest in things you usually enjoy, or if a partner mentions that you snore loudly or stop breathing during sleep, those are signs you should see a doctor sooner. The GP can check for underlying issues like anxiety, depression, or sleep apnea that might need different treatment. They have more tools available if the lifestyle changes aren't enough on their own. Does that give you a clearer idea of when to seek further help?
I feel much better, actually. More hopeful. Thank you so much for your time and advice, Kevin.
You're very welcome, Mihiraa. It's my job to help. Start with 1 or 2 of those changes tonight and see how you go. Take care.